Hello friends, I am Prabhjot, your occupational therapist, and today I am addressing queries on the topic of mirror therapy for upper limb in stroke survivors. Mirror therapy, I have made a number of videos on that. I will leave a link above, but I'm going to address some specific queries that you have regarding how mirror therapy exactly works. Please share this video and like this video to boost the channel also, and so that maximum number of people can benefit from it. Also, don't forget to subscribe the channel because I post regular videos on neurorehabilitation on this channel. Query number 1. What should be the state of the hand in which mirror therapy can be practiced? If after a stroke your hand is stiff, it's been a while, or even in the initial stages your hand is stiff, you cannot make any independent movement of your hand, mirror therapy does not work as well, because it is required after practicing the movements of mirror therapy, you are supposed to practice them with your weak hand also. But if your hand is tight, it is stiff, there is no movement at all, it's really not going to help you much. But if you feel that there is some independent movement possible, maybe of the fingers, even if it is together, all the fingers are moving in unison, it is still going to help you. Query number 2. What should be the measurements of the mirror used in mirror therapy? Well, the mirror can range from 12 by 12 to as much as 28 by 48 inches, so the mirror can be quite long. The important aspects of this are: first, the mirror should be large enough to reflect the entire unaffected arm. It should be placed at the midline of the patient. If you are not able to see the mirror, it can be placed closer to the affected limb and angled slightly. Query number 3. What to do with the affected hand which is behind the mirror right now while you're practicing movements with your good hand, your stronger hand? Well, at the time of mirror therapy, you only focus on the movements and look at the movements, because it will give you an illusion that your affected arm or your weak hand is functioning, is doing all the movements, and later you try to practice the same movements with the affected hand, the weaker hand. So make sure that whatever movements you have covered with your good hand, let's suppose it was the right hand, you practice the same with the weak hand as well. Query number 4. Is mirror therapy useful even years? So one person asked if it is going to benefit them even 9 years after stroke. I asked them a simple question. Do you have any kind of individual movement of your hand? They said yes, there is grasp, there is release, some thumb movement is there, but the fingers are just working in unison. I said you are good to go for mirror therapy and practice it regularly at home, and I did mention the duration should be at least 30 minutes in a day. Next is, what should be the material with which the mirror should be made? It is okay to have a plastic framing around the mirror, a wooden framing around the mirror, or even if it is made from within a cardboard. Important thing is that you should be able to see the reflection of your stronger arm in it completely to be able to appreciate the movements and later on practice them. And the final query for the day is mirror therapy only affected in the upper limb? Well, it does work for lower limb also, for balance activities also, where exactly you're not hiding the limb but you're practicing balance activities with the mirror as a mirror feedback, just to understand how you're balancing, whether you're able to understand or appreciate your midline, and then perform the balance activities accordingly. And it even works for face. If stroke has affected your face, to practice movements on both sides symmetrically, it is also beneficial. I hope this video helped to answer a few of your queries and doubts that you had about mirror therapy. Hope this video was beneficial, and if yes, do like and share this video so that maximum number of people can benefit from it. Don't forget to subscribe the channel because I do post videos on neurorehabilitation on a regular basis, and ring the bell icon and do add any queries or suggestions related to stroke recovery or mirror therapy in the comment section below. We'll meet again soon. Bye.